Now, moving towards the stages of tissue response to increase occlusal forces actually. So, before we have discussed the types, what is trauma from occlusion, the types we studied actually. So, now moving to the stages. So, let's start it. Bismillahirrahmanirrahim. So, here we have three stages: injury, repair, and remodeling. Here we will study first of all injury. In injury, we will study three substages like slightly increase in pressure and tension, greater increase in pressure and tension, and severe pressure and tension actually. Now, always remember when there is a pressure, there is absorption, and there is a tension, so there is formation. So, when there is slightly excessive pressure, so there is resorption of the alveolar bone with the widening of the pedial space, but excessive tension causes elongation of the pedial fibers and the apposition of alveolar bone, which means the formation of alveolar bone. Okay, it has also that in pressure the blood vessels become numerous but they reduce in size as compared to tension increase, so these vessels are they becomes enlarged. When there is actually greater pressure, so what things happen? On PDL, there is actually a gradual changes occur. What happens the fibers? The fibers are compressed in those areas where hyalinization has to occur. Subsequent injury to the fibroblast and other connective tissue cells leads to necrosis of the areas of ligament. When there is injury to fibroblast, what happened? The fibroblasts are present in the connective tissue that form the collagen, and the collagen is very important for the ligaments. So when there is injury to the fibroblasts, so then and other connective tissue cells, so there will be necrosis of the areas of ligament. Vascular changes are produced like they have discussed three. What happened within the 30 minutes, what at 2 to 3 hours, and then between 1 to 7 days. In within 30 minutes there is impairment and stasis of the blood flow, means the blood flow starts to accumulate or either impair. At 2 to 3 hours, the blood vessels appear to be packed with erythrocytes, which pigment, and between 1 to 7 days, there is a disintegration of the blood vessel walls, means the blood vessel walls become either break or damage, so the contents comes out in the surrounding tissues. Okay. In addition, there is an increased resorption of the alveolar bone and resorption of the tooth surface that occurs actually. Greater tension. In greater tension, they have said that the pedial spaces are widened. Hemorrhage is happened, thrombosis, also tearing of the pedial and resorption of the bone. So what happened? There is thrombosis, hemorrhage, the pedial, what happened? They become tear, break, and the bone is resorbing. Okay, when there is pressure enough to force the root, means the pressure severe is enough to force the root that against the bone causes necrosis of the pedial and bone. So what happened, that there is so much pressure on the root, so it led the against the bone that causes the necrosis of the pedial and bone. The bone is resorpted from viable periodontal ligament that is adjacent to the necrotic areas, means though the bone is resolving again those pedial and adjacent necrotic areas from the marrow spaces, and process called undermining resorption. Undermining resorption is basically the resorption or then necrosis from the viable periodontal ligaments that is adjacent to the necrotic areas or from marrow spaces. Okay.